I'm here with Dr. Brujic at the Rinsada booth in 2024 Vision Expo East. Dr. Brujic, good to see you.
Thank you.
Fellow Ohioan.
Yeah, that's always a good thing.
Sort of by disguise, though, because you're really a Canuck, correct?
Yeah, exactly right. Originally from Windsor, Ontario, Canada.
Right, exactly. So we chatted, I don't know if you remember this, we chatted a very long time ago, and it was actually virtually.
Yep.
And you were probably the only person that ever responded to me, which I always am very thankful for. But we chatted virtually about Rinsada. And when we first talked, I mean, what were kind of your initial impressions before the device was even in hand? What did you think?
Yeah, the first question was, what is it?
Yeah, fair.
And then when I figured out what it was, I realized, okay, there's a spot for this.
Sure.
Especially compared to what we were currently utilizing as the standard, which was nothing.
Sure.
We just start treating the ocular surface, and it's almost like if you think about painting a wall, but not putting a primer on, or not making sure the wall that you're painting is clean. That's kind of what we were doing when we were treating allergic conjunctivitis, when we were treating dry eye. So the technology almost made immediate sense, but I'll tell you the thing that I loved about the initial communication with you. You're a clinician.
Yeah.
So I didn't have to explain anything to you about the nuances around the eye. You kind of already knew everything. So every question that I'd asked you, you already knew. You thought about it, and even in the design, you had already kind of taken what I was thinking 1, 2, 3 steps ahead, and you're like, yep, we already incorporated into this because we knew this was going to be a challenge or an issue, and we wanted it to be easier for the clinician.
Sure. And so I think in terms of ocular surface disease, there is obviously at Expo East we see this really magnified, is that there's so many choices out there, right? There's so many different kind of things that a person or provider or physician can provide. How does Rinsada really fit into your algorithm? How does that kind of work?
So you need to take a step back and understand what our most contemporary body of knowledge is right now, and that's artificial tears as kind of a baseline along with environmental modifications. And I think the reason those two things were put in was for a few reasons. One, environmental modifications to try and reduce or mitigate some of the challenges that our eyes are stressed with, and also some of the environmental pollutants that we can sometimes be exposed to. And two, artificial tears not only for its lubricating effects, but also for its natural, somewhat cleansing effects. You're placing fluid on the surface of the eye. So when you now take that and you say, all right, in the clinic, we can actually control both of those variables through the removal of a lot of these things, we immediately see that Rinsada has a logical role at every step of this process. In particular for those patients coming in with a high level of symptoms, because we can immediately irrigate the ocular surface. We can essentially reset the ocular surface with this Rinsada device and give us the ability to now start treating in what I would consider a more clinically logical way.
Sure.
Because now we've removed excessive levels of inflammation specifically, and you guys did the studies where you saw a reduction in inflammation 3 hours and also a month later. So we can now do it more logically, clean the ocular surface. Now let's start treating it with logically what we're actually going to be doing.
Yeah, that's great. Well, thank you very much for your time. I do appreciate that, and it's good to be. I hope you have a great Vision Expo East.
Thank you.